This Focus on Health segment is brought to you by Aurora Healthcare.
Hi everyone, welcome back to Oshkosh Today. I'm Connie Carmical. In this Focus on Health segment, our expert from Aurora Healthcare is going to help all the people out there with a disorder that many suffer in silence with. It's incontinence, the loss of bladder or bowel control. It's not a disease, but a symptom of other underlying disorders. But there's new hope in the rehabilitation department of Aurora Medical Center here in Oshkosh. Tiffany Fisher, a physical therapist, joins me now to discuss new advances in stopping incontinence and pelvic pain. Tiffany, thanks so much for joining us today.
You're welcome.
Why don't you give us a little bit of background about your physical therapy and what you do here at Aurora?
Well, when people think of physical therapy, they generally think about treatment of the shoulder or the back or the knees, but the thing that people don't think about is treatment of the pelvic floor muscles, which can really be involved in incontinence and pelvic pain. What I have learned through all the couple years I've had of experience with women's health physical therapy is that it really can impact people's lives, and there is something that can be done about it. I did my training with a therapist who had over 15 years of experience in women's health and is certified in pelvic muscle dysfunction biofeedback. That's also a certification I am working towards myself, as well as my certificate of achievement in pelvic physical therapy through the American Physical Therapy Association.
Oh, that's great.
And when I first began treating here at Aurora, the women's health program, there was very, very small amount of patients in caseload. Since that time, the caseload of women's health patients has been about 50% of my entire caseload, which has actually extended us to the Fond du Lac market, as well as adding an additional physical therapist.
Well, tell us a little bit about what is incontinence.
Well, incontinence in general is the loss of bowel or bladder control, and it can impact people's lives, like we had said before. But the thing that people don't think about is incontinence, when you talk about the bladder, that there's different types. And the three main types I treat are urge incontinence, when somebody has a strong urge and can't make it to the bathroom, which can also result in increased frequency, or stress incontinence, which is caused by physical activity, such as coughing, sneezing, laughing, jogging, running, and for some people just simply walking. The other kind is mixed incontinence, which is a combination of both urge and stress incontinence. And the most important thing to remember is incontinence is simply the leakage of any urine.
Okay. And then I suppose you sometimes have pelvic pain with this. Can you talk a little bit about that?
Yes, pelvic pain. When I treat a patient for pelvic pain, what more than likely they're coming in with symptoms are including something with pain with sitting, pain with intercourse, or generalized pain to the pelvic region or their low back, as well as their hips.
Okay. And then describe what a typical evaluation consists of.
Evaluations for the physical therapy program start with simply education on anatomy. We start by getting the patient comfortable with what's going to be done in therapy. Most people aren't really aware of what's going on with their pelvic floor muscles or their bladder or their bowel movements or anything like that, so we always want to educate. I feel that the most information patients have coming in, the more compliant they're going to be with the actual treatment. So what we usually start with is just a gross evaluation, looking at their movement, their mobility, their alignment, their posture. From there, we go ahead and we take a closer look at their pelvic floor muscles, which can really tell us a lot about what's going on with control of that bladder or bowel issue.
Okay. And you talked a little bit about treatment. What are some of the treatment options?
For treatment, some things that we would start with is simply we talked about education. Not only education on anatomy, but on dietary irritants. Secondly, we would take and look at if there was an issue with alignment, posture, any of those things, we would address those by stretching or generalized strengthening. Also, we can look with the pelvic floor muscles, and from the evaluation, we determine exactly if there was a dysfunction. And if there's a dysfunction, we do pelvic floor muscle exercises, which people know as Kegels, but they're very specific to each individual patient, and that's why the evaluation process is so important to determine if the patient is doing the correct Kegel exercise.
Sure, okay.
And then in addition to that, the last thing that we like to do in treatment, at times, if necessary, is biofeedback and electrical stimulation.
Okay, talk a little bit about that.
Biofeedback is simply a computerized system that uses an electrode for patients so they can see their pelvic muscles working on the computer system. It's not needed for everybody. The misconception out there is that in order to treat incontinence, you need to do biofeedback. If somebody has complete pelvic floor muscle control and coordination, there's no need for biofeedback. If somebody has lack of control or quality of contractions, it's something that can aid the patient in getting better. As far as electrical stimulation, That can be done if somebody has severe weakness in their pelvic floor muscles. It can help strengthen the muscle, as well as if somebody has urgency, it can help decrease the overactiveness of the bladder.
Okay. Now, do you find, I'm just curious, do you find that there's more, the older you get, the patients are older, or is it any age of people?
All ages. Okay. The misconception is it happens in people that are older that have had born children, and that's not necessarily the case. I have spans of young to the older population, and everybody that comes in has the ability to improve in their symptoms.
So this is the type of physical therapy. About how many visits on average does a patient have to come for?
The average number is 4 to 6 visits, but that number is variable because of certain things, such as if there's complications or significant weakness, or if it's stress incontinence, that seems to take a little bit more time. And the biggest thing is compliance from patients. If patients are willing to be compliant, it's going to take longer time. But what everybody needs to understand is that the results that I've seen with this pelvic floor treatment is that it can really make an impact and change a person's life. And if they're having these issues, they should definitely give us a call and see if there's something we can do about their symptoms.
Oh, that's great information. And if anyone does want any other information, your number is 456-7100. Is there anything else you'd like to add? Because I do think a lot of people maybe are embarrassed by this and they really don't want to contact their doctor. But is there anything else you'd like to add?
I'd just like to say that if when we talked about my caseload, 50% of the patients I treat, and I work full-time, are women's health patients. Therefore, these patients are not alone, and there's something that can be done. And it does make an impact on their lives. And I've just heard from the patients how remarkable it is to change their life and get back out into the population without feeling embarrassed or scared that they're going to leak or that they can't participate in certain activities because of the pelvic pain they're experiencing.
Because there is help out there then.
Yes.
That's wonderful. Well, thanks so much for joining us.
Thank you.
If you'd like more information, you can always log on to the Aurora website at aurorahealthcare.org. Incontinence impacts a person's self-esteem. It affects both emotional well-being and independence. But as Tiffany told us, there are non-surgical techniques, so you don't have to suffer in silence. Please call Aurora Rehabilitation Department at 456-7100 for more information about your health options. Thanks again for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.